When determining the time or timing of the medical travel process. Determining the timing of medical tourism involves complex factors like medical treatment availability, patients' health, and travel logistics. Healthcare providers can address the 10 when questions related to medical tourism to help patients determine the best timing for their medical travel process. 1. When is the best time to schedule the medical procedure for medical tourism? To determine the best time to schedule a medical procedure for medical tourism, healthcare providers should evaluate the patient's medical needs, condition, and the availability of medical facilities. 2. When will the medical procedure take place, and how long will it take? To enable patients to plan their medical travel process, healthcare providers should provide a detailed timeline of the medical procedure, including its expected duration and timings from virtual consultation to aftercare. 3. When is the best time to start planning and coordinating the medical travel process? The optimal time to start planning and coordinating the medical travel process is about 90 days before the planned medical procedure, although it may vary based on factors like the intricacy of the procedure, the destination country, and visa requirements. 4. When will the patient be able to receive follow-up care and treatment after the procedure? Healthcare providers should provide comprehensive instructions regarding post-procedure care and follow-up appointments, which can involve in-person checkups or remote consultations via telemedicine. 5. When will the patient be able to return home after the medical tourism procedure? The length of a patient's stay in the destination country after a medical tourism procedure depends on the procedure type and recovery progress, and guidance should be provided by medical tourism providers to determine the appropriate duration. 6. When are medical travel insurance and financial arrangements due or required? Medical travel insurance and financial arrangements should be completed prior to the trip, including arranging coverage for unexpected medical expenses and financing options to cover medical procedure costs, travel expenses, and accommodations. 7. When will the patient be able to obtain and transfer medical records between the medical facility and their home country? Before undergoing a medical tourism procedure, the timeline for obtaining and transferring medical records should be clearly discussed with the provider. 8. When is the best time to obtain a second opinion about the medical procedure and the medical tourism option? Patients should seek a second opinion as early as possible before making any final decisions about undergoing a medical procedure or medical tourism, and providers should offer a formalized virtual consultation and second opinion process. 9. When will the patient be able to get a clear understanding of the risks and potential complications of the procedure, and how they are managed and treated? During the informed consent process, the healthcare provider should clearly explain the procedure's risks and complications, how they are managed and treated, and provide resources to address any concerns. 10. When will the patient be able to get answers to any concerns they may have about the medical travel experience? Patients should have access to healthcare providers who can address any concerns they may have about the medical travel experience before, during, and after their trip. Providers must address timing concerns to help patients plan and coordinate medical travel effectively, providing transparent information and support for informed decision-making, preparation, and successful outcomes. Consider joining PlacidWay for world-class medical care abroad.